Hi, everyone. I'm Dr. Katie Varman, and today we're talking about phototherapy, which is probably my favorite treatment modality that we offer here at Shine Dermatology. And I wanted to start the discussion by showing you a few cases. This is an example of a patient with psoriasis, and you can see that she had a pretty thick plaque of psoriasis on the mid-lower back. You can see the before and after picture after just 4 to 6 weeks of UV phototherapy. And this is without topical steroids or without any oral medicines or really any other intervention other than the light. This is an example of a skin condition called nummular dermatitis. It looks a lot like psoriasis, but it is its own distinct entity and much more similar to eczema. You can see she had very nice progression over the course of about 6 weeks for her nummular dermatitis with complete clearance. Also, no topical steroids or any other interventions. So there are a variety of skin conditions that we can treat with UV phototherapy. In addition to hives, eczema, psoriasis, there's other skin conditions that are very responsive, including vitiligo, dermatitis, itching of unknown cause or known cause, lichen planus, granuloma annulare, C2CL, among others. Phototherapy essentially means healing with light. When we talk about phototherapy in dermatology, we're really referring to ultraviolet light phototherapy, usually UVB, but sometimes UVA. UV light extends only into the top layers of the skin, as you can see in the diagram here, and it is a shorter wavelength. There are other types of light treatment. You'll hear things like photobiomodulation or low-level light therapy. This uses visible light or near infrared light, and this is a longer wavelength that penetrates deeper into the skin. It's used to promote healing and for pain reduction, but it is very different than UV phototherapy. You'll also hear things like photodynamic therapy, which is a tool we use in dermatology. Photodynamic therapy uses light to activate sensitizers that are put on the skin, which destroy precancerous cells like actinic keratosis. So again, very, very different. And in the world of dermatology, if you hear phototherapy, we're usually talking about UVB phototherapy. Here at Shine Dermatology, we have a couple different devices to treat your skin specifically. So we have a full body unit, which will treat you head to toe. We have hand and foot devices used to treat hand and foot dermatitis or psoriasis in these areas. We also have a targeted laser unit, which can really pinpoint those troublesome spots, and it's great for vitiligo. And then lastly, we also have a brush that we can use for scalp psoriasis and other irritation in the scalp. As far as what to expect, phototherapy treatments are very quick. The first treatment lasts about 30 seconds, and we work our way up over the course of a month to about 2, sometimes 3 minutes. Treatments start at 3 times a week to get you up to that gold dose, and then once we're there and your skin is feeling much better, then we reduce the treatments to about once a week. Some people stay at once a week for a while in maintenance to keep the skin clear. Other people are able to stop depending on the nature of your skin condition. And how does it work? So phototherapy has a very beautiful mechanism of action. We know that most skin conditions, things that are rashy like eczema and psoriasis, are caused by an inappropriate activation of immune cells in the skin. And what phototherapy does is it actually causes those cells to disperse and just leave the skin and is thereby quite anti-inflammatory. Phototherapy also has benefits inside the body and reduces inflammation at the level of the spleen, the lymph nodes, and the bone marrow. It does this really neat thing where it increases a type of cell called a regulatory cell. Regulatory cells are like our body's natural off switch. And so when you increase these cell type, then it causes a reduction in inflammation. Phototherapy also balances the microbiome of the skin, which is very, very useful for things like eczema. It causes a reduction in pathogenic or damaging bacteria like Staphylococcus aureus and increases other types of staph, which are actually beneficial. Lastly, it can also improve mood by releasing endorphins and has a variety of other effects that can be beneficial as well. For the question of is it safe? Yes, UV phototherapy is a very safe treatment modality. We do know that ultraviolet light can increase the risk of skin cancers over time, but we have decades and decades of research with UV phototherapy that do not show an increased risk of skin cancer even after long, multiple years of use. So we take this potential risk very seriously. We talk about risks and benefits. We do nice full skin checks. But all of our research really does demonstrate the safety of this treatment option. So thank you very much for listening. If you think phototherapy might be a good fit for your skin condition, I hope that you give us a call.